that we're not missing anything. So actually, if you've got you've been having you're really struggling with Joe's sort of chronic ingrown toenails, which you just can't seem to sort of get a hold of, or we've seen in a lot of leader reviews recently actually just chronic leg ulcers, and just we're not managing to get on top of that. Those are the sort of by completing that pre-health check questionnaire, you can really drill in onto the main points to make the best use of the very limited time that you're going to have with your primary care clinician, because we know that time is short. So that pre-health check questionnaire is really vital. As I say, if it's a really amazing GP, they might send out a copy with the invite letter and ask you to complete it. But if not, as I say, there is a digital copy, which, once you've got the invite, you can sort of take that initiative and go through with that person before the appointment and send in. So it's really, really good. It's worth sort of considering desensitisation. We know some people have, phobias around needles, around, even having their blood pressure taken. So, if you know that that's a particular issue, I mean, hopefully we're putting a bit of time in, because this can take a bit of work, but looking at that desensitisation work, how can the learning disability community nurses help with, putting a process in place to make sure that someone is more comfortable, accessing those interventions. I mean, it can be as simple as Steph's gone out with, she's borrowed one of my stethoscopes and gone out, to do chest auscultation, because that was just a step too far. So it's really about what does that person struggle with, and how can we put reasonable adjustments in place to provide that desensitisation work. Obviously, what we would hope is that the GP would have a record of that person's reasonable adjustments. That's not always the case. So, maybe if someone's being invited and for example, that a busy waiting area is going to be really problematic in keeping that person calm and ready to be able to have their annual health check. So maybe you can wait outside in the car park and someone will come out and get you when the doctor's ready. Or if they have a side room that you can maybe go in, which is a little bit confronting from a sensory point of view. These are all just really standard reasonable adjustments. And if you're not sort of convinced that the GP surgery is aware of them, perhaps you can contact them before the appointment and just go, look, I'm bringing Mary in next week. I just want to remind you, is there any way that we could do this, this and that before her appointment? Because in that way it's going to go a lot smoother. Mary's going to get the most out of it, and we're going to come away really happy. So these are all things that we can do to prepare. It might be that you're bringing a urine sample or a stool sample with you. Is there anything that you can do beforehand? We would always encourage, say if you're having a set of bloods before an annual health check, if we can't go into the surgery, can the district nurses come out or phlebotomists come out and do a set of bloods before that appointment? So actually, if there's something wrong with your cholesterol, if the HbA1c is a bit off, we can talk about it at that appointment. We can build it into their health action plan, rather than having the annual health check and going, okay, come back in 2 weeks for a blood test. Can we put everything in place so we're doing everything at that annual health check and we're not having to have multiple appointments, because that takes resource out of your day and it's also just a pain in the arse. So it's the way to make it sort of one appointment. Yeah, and so any health documents that you think might be useful. So are you keeping a bowel chart? So say, you might have become worried about that person's bowel movements, maybe over the last month, bring the bowel charts, bring their sort of urine chart, or, any paperwork that you might have done that maybe it's their, sort of like a behaviour monitoring chart, something, if you're worried, to sort of indicate the change that you might be seeing, because that can also be useful. Their seizure, it might be their seizure chart, whatever it is that you're recording, that's also really useful information if you're wanting to demonstrate potentially a change. Next slide, please. So I've talked a little bit about reasonable adjustments already, and as I say, hopefully these will be coded on the patient record. So hopefully some of you have heard about the reasonable adjustment digital flag. So all providers should be recording someone's reasonable adjustments on their system. Now, in an ideal world, they'd be recorded in the GP, and then if they got admitted to hospital, someone will be able to see them on their record. Digitally, we're not there yet, but that's the end goal, I think. But certainly making sure that the GP's got them recorded, so next time round you're not having to have the same conversation again, is really useful. And as I say, you know, they can be really, really simple. You know, minimal waiting times, as we've discussed, pre-appointments. You know, seeing a familiar clinician. Checking at the desk rather than self-service screens. You know, this can be a real bone of contention sometimes about, you know, checking and using these screens. So, you know, it's just about putting them in place beforehand, so it's all sorted when you arrive. Next slide, thanks. In regards to sort of helping people get their annual health check then, so there's lots of things that we've done. So, I mean, the ICB has a birthday card initiative. Again, this is more applicable to any carer supporting young people. So people get a birthday card on their 14th birthday, talking about their annual health check, making sure that they're on the learning disability register. That's another important point that I probably haven't mentioned. Hopefully everyone that you support with a diagnosed learning disability is on their GP's learning disability register. If you've got someone that you know has a learning disability, not a difficulty, a learning disability, and they're not getting their annual health check, it might be worth calling the surgery and asking, are they on their learning disability register? Because that should automatically trigger the surgery to invite them sort of every year. So that learning disability register is really important. If you've got someone that maybe isn't being invited. What we also have, again, this is something that Steph and her team produced, is learning disability annual health check reminder. So this is just something that maybe someone can take to their GP surgery, sort of like hand it at the desk, sort of reminding them that, I'm due for my annual health check and can we get that booked? Usually if you've got a good GP, this wouldn't be needed because actually they're doing it on a, but sometimes they're late. It may be actually that they haven't had their annual health check in 18 months. The way that people aren't scored on an annual health check within 12 months, they're scored on an annual health check once every year. So actually, if you've had it in January of 2023, your next one might not be until August of 2024. That's far over a year, but it still meets the within, once every year, if that makes sense. So what we want to do is make sure that we're not going over 12 months, because that's a long time when it comes to sort of monitoring someone's health and well-being. Next slide, thanks. So what should happen at an annual health check? So lots and lots of things. All of these sorts of things is what's discussed in the pre-health check questionnaire. But you might sort of things like a urinalysis, sort of chest auscultation, so listening to their heart, listening to their lungs and their breathing. Talking about dentists, talking about sort of whether they've been in oral care. That's especially important when we see the prevalence of aspiration pneumonia in people with a learning disability, as well as dysphagia. A lot of aspiration pneumonia comes from something called silent aspiration. So we're inhaling saliva and mouth fluids essentially. If someone's got really poor oral health care, that saliva is going to be teeming with bacteria and all sorts of nasties that go straight into the lungs and ends up with a whacking great pneumonia. So oral health is really important when it comes to the annual health check for people with a learning disability. But things like opticians. Have they had do they need their ear syringing, and has that happened? Looking at the difficulties in communication that we see for people with a learning disability. If we're putting barriers in the place that their glasses prescription is out of date and they can't hear anything, these are all sort of things that are completely avoidable when it comes to barriers to communication. Social care, when was the last care act assessment? Is their DOLS up to date? Do they have a primary carer at home, maybe an aging parent, and have they had a carers assessment? When you're looking at the wider holistic person and everything that keeps them well, these are things that we need to be talking about. If their primary carer is an aging parent and that parent goes down, where are we going to be? So these things are really important to consider when we're looking at their wider health determinations. Who's important to that person and who are the professionals involved, that's around, building our NDT and making sure that we're aware. I'm sorry, I don't know if I'm going over time. I'm just waffling, just do the other. Okay. So medication reviews are vital, and making sure that we're adhering to STOMP principles. So again, I'm hoping that everyone in the room has heard of STOMP, which is stopping the over-medication of people with a learning disability. What we don't want to see is people, sort of over-medicated on psychotropic medications for a long period of time. So are we caring for someone with on a long-term antipsychotic when there's no psychosis diagnosis, and that person hasn't been seen by secondary mental health services as far back as I can remember? Have we got that person on a regular PRN dose of benzodiazepines, so diazepam, lorazepam, and actually, again, we don't really have any formulation. We don't have a PBS plan for this person. Is there any way that we're managing, these behaviours that we might find challenging as, giving them benzos? Do we have we got certain medications prescribed just because the person has a learning disability, which we have seen reason for antipsychotics being prescribed as learning disabilities, which isn't something. So these are all sort of things that we want to see addressed as part of an annual health check. Vaccinations, massive one, really, really important one. And actually in Norfolk and Waverley, we're really great at that. Flu vaccinations especially, really good. We're up in the high 80s. I mean, I'd always like it to be higher, but we're up in the high 80s, which is fab. Pneumonia vaccines, not quite as good as we want to be, but certainly getting better since we've started highlighting it as a problem. One of the main issues is that, unfortunately, unlike the flu vaccine, learning disability isn't considered a high-risk category as part of the Green Book for pneumonia vaccines. But what is things like if they've got cerebral palsy, if they've got sort of a really vulnerable chest because of sort of a chronic chest condition, maybe if they've got COPD, or maybe, obstructive sleep apnea. So there might have to be some thinking out of the box and sort of saying to the GP, do we need a pneumonia vaccine here? Unfortunately, the national system doesn't really support us in the pneumonia vaccine uptake, but it's certainly something that we could do. And it might be that the annual health check, you want to combine it with certain long-term condition checks. So are they seen regularly for their diabetes? That sort of thing. Have they had their retinopathy screening? Have they had their diabetic foot checks? So if the person has a comorbidity, and most of the people with a learning disability do, on average, locally, looking at our learning from LEADER, most people have 4 to 5 comorbidities if they have a learning disability. So it may be that those long-term checks are really, really important. So we talked about the health check. Now, I'd anticipate everything that sort of would come in the 14 to 74 health check actually being covered by their annual health check. And bearing in mind the annual health check is every year, but the 40 to 74 is every 5 years. So actually, you'd expect someone to be getting that, if it comes up and they get invited, take them. do you know what I mean? I am very much encouraging as much sort of like oversight and support as we can, picking up on hypertension really, really early and managing that. So, no issues, kind of maybe one every 5 years they see the doctor twice or whoever twice. That's certainly not a problem. But generally, the annual health check happens every year. So that should be happening more frequently anyway. Another thing we might be looking at is respect planning. Hopefully all of you have come across respect forms. Now, what hopefully you've also seen, so recently I've contributed some work about producing a respect policy for the Norfolk Waverley system. And that's kind of like a guidance really for providers to adopt on how we manage respect and how we sort of support respect conversations. That's a really important conversation to be having in the community about, what's the best for that person when it comes to emergency care planning. But also on top of that, end of life, a lot of you guys support people when it comes to, their end of their life. And we see really amazing work from leader reviews with providers that really do go above and beyond to support someone to die at home. And actually leader reviews, we've seen a lot more people die at home and a lot less die in hospital. And that's great, but we often find is that providers are really under-supported when it comes to delivering really quite complex end-of-life care, which considers, complex symptom management, all of these things that are really quite terrifying, especially for staff that aren't necessarily clinically or medically trained. So as much support as we can get with end-of-life care for providers is also important, and that's about preparation. Have we referred to the palliative care team? Do we have anticipatory medications prescribed? Have we got a symptom management plan? So all of these things are also what could come out of an annual health check. Maybe for someone that is deteriorating, maybe they have a hospital avoidance plan, and it's about keeping them as comfortable at home as possible. Smoking, also, a big one. We want to move away from smoking as much as we can, but I'll be honest, we don't see a lot of smoking in the leader review. Certainly, it is something that we look at, and more generally, it's for those that have a mild learning disability and relatively more independent, so we don't see a lot of smoking. But I will mention smoking and emollient use. And some of you might have come across to one of the webinars recently that I've been doing around sort of the fire risks and use of emollients. And again, that's another thing that we can look at in annual health checks. Does that person use emollients, and are they at high risk of fire? That's something else that I can maybe send out after for anyone that's not sure. There's a resource there and training for staff on that really important issue. And lastly, sort of on this slide, thinking about syndrome-specific checks. So there are things like, for example, Down syndrome, where there are very specific checks that we'd like to see. So Down syndrome, it's around cardiovascular health, because we know that there's high interactions between heart disease and Down syndrome, but also thyroid checks. So there are certain syndrome-specific checks that are important to account for depending on that person's diagnosis. Next slide, please. And that's just, a couple of more things that we talked about, sort of today, things that are really important to be covered. So I mentioned health action planning at the top of the presentation, and this can be as simple as what a health action plan looks like. So, on the left, what are the issues? So, for example, Joe Blogs has had a consistently high BMI for the last 3 years, and we don't seem to be moving anywhere with it. So what needs to happen? We like to engage in some tier 3 management support. We like sort of the specialist LD team potentially to have a look and see what we can do to bring the weight down. So, and essentially, what is the plan and when do we want to review it? So it's really simple when it comes to health action planning. It's really not complex, but what it does do is it creates accountability for supporting someone to achieve the goals that are going to help them live healthier lives, but also longer lives. Last slide. Thank you. So this is our health improvement team for learning disabilities, who are absolutely amazing. So that's Steph, top right, and then Layla, bottom left. And what they can do is they support with all elements when it comes to annual health checks. So they support with auditing of health checks and improving quality of provision. They can provide clinical advice and case discussions specifically around annual health checks and preventative care. What they don't do is replace the community LD nurses, but they're specifically around LD health checks. They can provide outreach to patients and engagement with communities. They can do training, so they do really great training programs for GP practices, but also providers. So if you want them to come in specifically and talk to members of your staff, they can do that. They have both a clinical training set, but also admin. The admin tends to be more primary care, maybe the person's booking the annual health checks and that sort of thing. But again, you might have a lot of administrative staff that, does support in regards to arranging these things. So, they're really flexible depending on what your need is. They do a lot of promotion at schools. Again, for those that may be running some form of day centre, they can come in and do, they could do BPs, maybe not necessarily to give a reading, but again, that desensitisation and familiarisation work. The guys do a lot of work on the WOW bus, sort of which has been mentioned, a lot of outreach to try and support engagement and uptake with annual health checks. And also, to support the elderly registers, but again, that's more primary care focused. But they can be contacted on the email on the screen. So if you want some support regarding annual health checks within your provider, then just drop them an email and they can give you a call, talk about what your needs are and see how they can help. So they are really, really amazing and worth their weight in gold. So do use them if you think they can be helpful.